Hello, today we're going to learn how to use the ToeFix device for treatment of ingrown toenail, without surgery, without pain and without side effects. And here are the tools we'll be using. The procedure requires the use of gloves for hygiene, and here are the parts of ToeFix: the crane, the anchor, and the screw which goes into the crane, combined after a cleaning process with acetone using cotton swabs. And filing with disposable sandpaper or the Dremel device. After the preparation, we glue using the epoxy tube which we place on the dispenser and connect the funnel to the glue. After the application of the glue, we use the fan to hasten the hardening of the glue. After 30 minutes, when the parts are glued, we can tie with the string the two parts right after taking the top part of the anchor off with the cutters and start the lifting process with the Allen key. After lifting the nail for 30 to 60 minutes, a splinting process of about 3 days begins, and that's the end of the treatment. We begin the process of gluing with the cleaning of the nail, preferably the whole toe from fat residue, with acetone, and using a new swab to clean the device on the surface side which will be glued. You may notice that the thread is already attached to the anchor, and the device is under my supervision the whole time during the gluing process. I prepare the crane by inserting the screw in and prepare the surface of the gluing with the sandpaper. Or using the Dremel device. After the preparation of the surface, I take a new cotton swab and clean the surfaces once more, using a new applicator for every surface, nail or parts of the device. At the end of the cleaning process, the nail has to be dried using the fan for about 3 minutes. I'm assisted by the patient in protecting the toe from excessive heat and setting the heat to a level so no unnecessary pain is caused. The heating process ends after 3 minutes, and now we are ready to start the gluing process. In order to load the glue, we place the tube onto the dispenser and lock it. Unscrew the cap of the tube and check that the glue comes out as we squeeze from both tips of the tube. Then we place the funnel, we twist it 90 degrees to lock it, and check to see that the glue mixes as we squeeze the dispenser's handle and is pushed out of the funnel's tip. Now I have approximately 5 to 6 minutes for gluing. The nail is clean, the device is clean. We apply the glue generously for this process. After the glue has been applied, we stick the anchor to the area of the nail which we wish to lift and break off the handle from the anchor. At this point, the glue is still very soft, and using an applicator, we can remove excess glue and adjust the anchor's position. The other part of the device is similarly applied with an adequate amount of glue and placed in the desired side of the nail, as its tip is set above the anchor. If there is any glue which bridges between the anchor and the crane, this is the time to remove it. We heat the glue and try to protect the toe from excessive heat. The heating takes about 30 minutes, after which the glue is hardened, and now we can insert the thread into the crane and tie it. We should tie a firm knot once or twice, enough to make us sure that the knot would not open. After the knot is tight, we remove the excess thread with the cutters or scissors. For the lifting process, we use an Allen key, which is inserted inside the hollow screw and is turned clockwise. I let the patient do the lifting so he can feel when the thread is pulled and if any pain starts. And now, as you can see in the simulation, without surgery, without pain, without complications, and without side effects. ToeFix.